Welcome to this podcast presented by Dr. James Woodall, Co-Director of the Centre for Health Promotion Research at Leeds Beckett University. In this podcast, James discusses the current health profile of the prison population and outlines some of the reasons why the health of those inside is relatively poor. James suggests that a greater focus on health promotion and public health within prison settings would pay dividends for wider society.
We're now at a stage where we have really good research and epidemiological evidence that shows that people in prison consistently demonstrate poorer health and social outcomes than comparable groups in the general population. So mental health problems, long-standing physical disorders, drug and alcohol issues are all very common in prison populations. And in addition to this, social issues such as poor educational attainment, lack of engagement with normal societal structures, low self-esteem, lack of permanent residence in terms of accommodation and housing, again, are all very symptomatic of people who are in contact with the criminal justice system. One of the fundamental questions is really considering why the health of the prison population is so poor. And we can use a couple of theoretical ideas to help us understand some of the reasons why this may be the case. The first one is the idea of importation. And this basically means that prisoners import their pre-existing health issues into the prison population. And a lot of this work was informed by Goffman, who suggested that inmates come into the institution with a presenting culture derived from their home world. So this theory basically suggests that prisoners have poor health before they arrive into prison, and they simply bring those current health and social circumstances into the prison population. Now, on the other hand, there's a slightly different model, which is called a deprivation model of prisoner health. And in the deprivation model, it suggests that prison itself is the cause of poor health. So things like overcrowded prison systems have implications for the transmission of communicable disease and for potentially limiting prisoners' access to services. So perhaps there is something about the prison environment itself that makes it a poor environment, which then impacts on individuals. So as an example, studies show that many prisoners are motivated to stop smoking, but often increase the numbers of cigarettes that they smoke in order to deal with the boredom of prison life. Now, for me, a more persuasive argument is a more hybrid or integrated model whereby a combination of deprivation and importation contribute to prisoner health. Most prisoners serve relatively short sentences, and therefore any improvement in the prison population will have benefits for the communities in which prisoners will return. In addition, there's some growing evidence that there's a ripple effect whereby improving the health of prisoners, which are overwhelmingly men, may have further impacts for prisoners' families and their children. But again, this association between improvements in prisoner health and improvements in their family's health, I think needs to be researched and explored a little bit further. I would argue that there needs to be a greater focus on health promotion and public health in prison settings. And the reason for this I'll explain in more detail in a further podcast. But essentially, any investment in improving prisoners' health can only be beneficial for wider society. I think in this country, certainly in the England and Welsh prison system, most prisoners serve relatively short prison sentences. And therefore, any intervention in the prison context that can improve health clearly has wider benefits for the communities in which prisoners inevitably return. I hope this podcast has been useful in outlining some of the health and social issues currently facing the prison population. I hope that I've been able to explain both the importation and deprivation models of health in prison, and to also suggest how public health and health promotion can really benefit not only those in prison, but wider society. Look out for my future podcasts where I'll be talking about prison health and the notion of a health promoting prison in more detail.
Thank you for listening to this podcast. Please do feel free to contact James via email or through Twitter to continue the discussion.